Once again, a family meeting last night, chaired by the president, as always. It was not actually as stringent as many of us would have anticipated, these new interventions announced by Ramaphosa last night.
Good morning, Michelle, and good morning to your viewers. Yes, indeed. I think people kind of had expectations that perhaps it will be more of a stringent economic lockdown in terms of the fact that we saw about over 4,000 new infections on Thursday. But I think it was really about Nelson Mandela Bay. It was about the fact that in the weeks preceding his address last night, there were lots of reports about how that metro has become a hotspot. And of course, the connection between the Garden Route, the Western Cape to the Eastern Cape, and of course, in the context of the rising second wave that we are seeing. So I think he was caught in a bit of a dilemma, because if he had to go with a stringent lockdown, we've heard what economic stakeholders have been saying. We heard what industry actors have been saying, including the Banking Association, and everybody's saying that we can't afford a stringent lockdown because of the economic impact it would have on livelihoods versus lives. Whilst recognizing that lives are important, I think there were also questions about how that may exacerbate the household income levels and people's levels of poverty and access to income, because we are entering the festive season, as you rightly pointed out.
Yeah.
It's going to be a tough one for everybody.
No, it is. And it is surprising. The president in his address last night said, Nelson Mandela Bay residents might feel like they are being targeted in terms of these localized interventions by government to curb a spread. And that's true. I'm sure that residents of that metro do feel targeted, because when you look at the numbers across the provinces, in fact, Gauteng's numbers in terms of COVID-19 infections are as alarming as are the Western Capes. So why not implement the lockdowns there as well, unless there was a major pushback from the provinces?
Yeah, you've basically asked a question which I think many of us are thinking about in terms of, is that the only hotspot that you're going to target in terms of what's going on? I think we also got to contextualize the structural conditions of the Eastern Cape, and in particular of the metro. The Eastern Cape has always been a seriously disadvantaged area. I mean, the poverty levels, the level of the HDI indicators, your human development indicators, the question of service delivery, etc. I mean, this province has always been with its back against the rope, and it's for a number of reasons that we don't have to revisit. But I think what's problematic, I think, for most people is the fact that if you take the Western Cape, if you take Cape Town, for example, yesterday the city of Cape Town issued a hotspot warning, and that includes part of, if you know Cape Town, parts of the southern suburbs. And I think to a large extent, with the festive season approaching fast, the movement between the Western Cape and the Eastern Cape and vice versa is going to be a big issue.
Yeah.
And I think also what's important for me is that whilst he announced these measures, and I know we can't constantly say it's government's responsibility, is how do people change behavior? People want to actually have something to feel good about in the festive season. And of course, in the Eastern Cape, it's not really a picture of, there's something we can look forward to as in the rest of the country. So I think the challenge here is, how do you implement the curfew? How do you implement the renewed alcohol times for sale? How do you actually monitor the 100 people in a venue capacity indoors and outdoors 250? What does 50% of that mean? Who's going to monitor that? And whether or not people will feel as if they're just they're sitting in a very precarious and perilous situation, and they'll just feel, well, what else do we have to lose?
Yeah, absolutely. And let's not forget about the environment in which the president was making this address last night. The issues around the public sector wage bill continues. You were talking about lives over livelihoods earlier. It doesn't feel like government has the appetite now to deal this second or third blow to the country's economy by locking the entire country down in some form of a hard lockdown.
Indeed. I think your headline about the SAA staff not getting paid is a clear example of that. For 8 months not getting paid, were the senior management of SAA getting paid? I think that's a bigger question,
Yeah.
a bigger structural question about the fact that we haven't been able to see whether or not we've been challenged by these questions of inequality within the context of wages, salaries, conditions of service, and so forth. I mean, the health sector, they're not going to be able to absorb anything after this. If they go on strike, I think we, as much as in terms of what's going to happen, we are just going to basically we're imploding. I don't know if there's another word I could use to describe what's happening currently. So I think the challenge here is, it's this something that COVID-19 has exacerbated in terms of how it has impacted on people's structural existence, on their livelihood, on their household income. I mean, why is it that these SAA workers are not getting paid? But rather, we need to ask ourselves is, why wasn't this resolved before COVID could hit as a black swan event?
Yeah, yeah, absolutely. I mean, can you imagine not receiving your salary for 8 months, especially at this time of the year? It's absurd. You know, the other big issue that the president did talk about last night was the issue around our being a part of COVAX. There's a lot of talk now around the vaccines that are in late stage emergency use development. There's talk about the US rolling out millions of vaccines by the 21st of December. We look at Africa, we look at South Africa, we're looking most likely to the middle of next year, possibly at the earliest, the middle of next year, when we see a vaccine. Did we get clarity on the issues around COVAX, do you think, Sanusha? We know that the president says the Solidarity Fund will now pay that, I think it was 327 million rand, towards the $500 million that was meant to be paid as a deposit to COVAX. Did you get clarity on that issue?
I don't think there's clarity in terms of who is in the first 5 countries that are going to get access to this global vaccine. The problem here, or the challenge here, is that if you have the money, you can afford it. I think countries like the US, like the UK, they are standing in line. There are so many competing firms that are producing the vaccine. I think there's the Pfizer, there's the COVAX, which is, I think, led by the Chinese. I stand corrected on that. And then there's another one which the Americans are hoping to get through their emergency legislation around the FDA, the Federal Drug Administration regulations. But again, the challenge, I think, is so fascinating, but also bemuses me, is the fact that we're in a pandemic, and we have to lay out this money, whether it's 500 million rand or whatever, in order to just essentially be able to say we in the line to get this. And I think the challenge would be is who will get it first. I think in the UK and the US and other countries, it's the frontline workers. I've read and I've listened to the US saying that they will use the military and the army to deploy, roll out. I mean, I think the challenge for us is, where do we fit in the whole kind of priority list? I think also there's competing firms out there in terms of the vaccine. So whose vaccine is going to be as effective as the other? Or is it going to be an overall effective vaccine for everybody? Or is one firm's vaccine going to be more effective than the other? And just this morning, unfortunately, we live in a world where cybersecurity is such a real threat to our lives that we heard that IBM had noticed there were hackers in terms of the distribution supply chain of the vaccine. So they hacked the system. So we live in such unprecedented, tumultuous times. And I think for us in South Africa, if we have to go forward and put that money out, can you imagine other African countries who are like Zambia, who is the first country that has defaulted in terms of under the COVID-19 conditions of its debt? Now, can you imagine if they can afford it? So I think we're sitting in a context where some of the rules around access to universal affordable medicine needs to change. South Africa has been doing that with India at the WTO. They've been pushing for that in terms of universal access. It's been a good thing. But we're going back to those times where the trims and trips around the WTO, the trade-related intellectual property rights, and investment measure services are becoming key drivers again at the WTO in terms of how countries are asserting their sovereignty and their national interest and sometimes selfish interest. So at this point in time, the global public good in terms of affordable access to drugs like the vaccine. I think we are beginning to revisit some of that in the context of what has been happening with HIV and AIDS.
Yeah, absolutely. Who will get the vaccine, as in which country will get the vaccines first? When will they get it, and how many doses will they get? All big questions that we still don't really have any definitive answers on. Sanusha, before we let you go, it's great to see the president addressing the nation. Great to get some clarity from him, just in terms of what the plan is for COVID-19 heading into the festive season. But it would be even better if, as journalists, as South Africans, we can be at the union buildings in some form of a socially distant media briefing, and that we can safely do a Q&A with the president. There are some big questions that we'd like to ask him as journalists, and I'm sure South Africans would like answers to as well. I mean, the last time we saw the president doing a Q&A, I believe, was when he addressed a SANEF briefing, and that was done virtually. But we've not, in months now, had a press briefing with President Cyril Ramaphosa.
Yeah, I mean, for me, I think they find it in a very kind of difficult or precarious or a catch-22 situation. I don't know whether they feel that by keeping it virtual and not allowing and enabling journalists to be able to be in the room at a safe distance, whether or not they feel that that's part of them demonstrating the regulations and upholding the regulations in terms of carrying it out. But I do think that at some point these family meetings need to have a Q&A, particularly in terms of asking the president or asking his team, his advisors, whoever's there, even like they do with now, there'll be a briefing by each ministry around the extension of the National Disaster Act. And I think they'll go around and explain this. Hopefully they will be doing that in the context of what the implementation strategy will be around the Nelson Mandela Bay as a hotspot. But again, it will be nice because you need to interact more with the public. And I think we also understand that it is a difficult position for the president. It is a hard issue to come out and say these are the measures, but also being aware that most of it is kind of out of his hands at times. He has to rely on the fact that he mentioned the 4-year-old talking about the regulations and what you need to do to keep safe. And I think it just tells you to what extent he's at pains to get South Africans to change behavior. But this is a global issue as well. How do we change behavior? How do we actually start thinking about what it is that we need to do in our community? We don't want to go back to a police state. We don't want draconian regulations. We want to have a little bit of our liberties to enjoy, but we also got to respect the fact that there's a social contract between the state and citizen, and there's a social contract in society. And that social contract means that I need to respect your rights and you need to respect my rights. And I don't need to be basically disrespectful and infringe on your rights because I feel that I need to assert my personal civil liberties. And I don't know to what extent as South Africans, we need to go back to that kind of thinking around the fact that the government is trying, but we also have to try. And we don't want to end up in like societies like the US, where we become almost in a state of complete carelessness because we say, well, you know what? It's my personal civil liberty and it's upheld by the Constitution. Yes, indeed it is. But unfortunately, this virus is not basically saying to us that our civil liberties take precedent over everything else. So I think at the end of the day, what I would hopefully like to see at the next family meeting that happens is essentially for the president to say, I'm opening up the lines for ordinary South Africans to have a conversation with me.
I couldn't agree more. Sanusha, as always, a pleasure talking to you. Thanks so much for coming on to the AM Report this Friday morning.